To start off our COVID-19 update, I will provide a situational update. Do want to note that for whatever reason, data from January 10th was not included from the Minnesota Department of Health today. Again, not sure why. So our numbers are 2 days behind. Our cases cumulatively are 8,905, and in the past 7 days, we've seen 378 new cases. And for perspective, the past 14 has only been 446, and so we are seeing our New Year's and holiday cases coming through strongly. I also want to say that because of the amount of testing that goes on with over-the-counter tests, that this is actually probably a lower number than actually what is circulating in Itasca County right now. Our 14-day case rate per 10,000 as of the 8th is 97.6. We're down to the 40s and 50s in the last couple of weeks. You can see we doubled. And these, again, are the ones that are confirmed by a hospital or a clinic or some of our pharmacies that are doing the testing, for example, through their drive-through, not ones you purchase. So there's definitely COVID here. 120 total confirmed COVID deaths. That's 13 since the last time I've been up with you speaking. There was 71 moving into September. So again, I've said this multiple times, we've had a really rough fall and start to the winter with COVID in Itasca. Average age of positive cases in the past 2 weeks is 39.5. It's been at 38, 39 for a couple of months at this point. Cases in our school and pre-K is at 17%, and this certainly could be due to the fact that they were out of school. I do want to say our schools are seeing other illnesses. Influenza is going through our schools right now in our community. So that's contributing to kids being out sick, plus there is COVID, and they have had more in the last few days just since break. Vaccines administered, 61% of our 5 and older have received at least one dose, and 57.9% of our entire population, regardless of age, have received at least one dose of a COVID vaccination. For our upcoming clinics, we do have 3 scheduled in January for public health, and of course we'll add more as the need arises. We have a work site that we will be working with, I believe it's this week. And then we have a Johnson & Johnson clinic on January 20th from 3 to 5 at the Itasca Resource Center. We have a Moderna clinic January 25th from 1 to 3 at the Itasca Resource Center. Anyone wanting to receive their first, their second, their booster doses are welcome to attend any of these clinics. Boosters are recommended for anyone 12 and older who are 5 months post completing their mRNA series. So that's the Pfizer Moderna, that's mRNA. And 18 and older at least 2 months following their primary Johnson & Johnson vaccine. Again, any of our pharmacies, clinics, public health will assist you in receiving those vaccines. If you're under 18, you need to receive the Pfizer, and so those locations include Scenic Rivers, Essentia Health, Grand Itasca Clinic and Hospital, Walmart, and Thrifty White. And then Moderna, Thrifty White, Walmart, Walgreens, CVS, Scenic Rivers, Public Health. And Johnson & Johnson is pretty much public health. Influenza, again, is spreading in Itasca. We still have influenza vaccine available. It's not too late to get protected. Just call our public health office to get scheduled, 327-2941. That's our main number for the Itasca Resource Center. And you just let them know you want to schedule a vaccine, and they'll send you to the appropriate person. Variant activity, Omicron is the active variant in Minnesota. Although we have yet to formally identify this in Itasca, it's pretty much looking like with the symptoms and the spread that it's here. We just haven't identified it yet. And just know that only a subset of PCR tests are sent to a lab for sequencing to determine which variant is active. So we haven't identified it formally, but we very much assume that it's here. If it's in the state, it's here. That's how COVID has progressed for us. Vaccines do remain very effective in preventing severe illness, hospitalization, and death. That data has not changed. Schools, again, we're talking to our schools weekly, if not more often. They all have varying levels of mitigation strategies, including masking, distance learning, per classroom or building level. There probably will be some changes in some of our schools this week. as they're evaluating their numbers of illness within their buildings.